Hey guys, this is Ask Reddit again with the best commentaries Reddit has to offer. Enjoy. Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Urologist sent patient to RED without informing her that imaging showed a glioblastoma assuring her impending death. He didn't overlook the disease, he overlooked the communication. He just sent her over for you to do the dirty work of telling her she was dying? Geesh. Here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Bleeding a little. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. Frown. In residency I saw a cardiologist miss a STEMI, heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though. Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen, and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. I like how you use the word bonked. I hope it was the same language in his medical record. Student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest X-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly I don't know what happened to him. The doctor but the patient. When I was born, I was my dad's 3rd child, 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there really wasn't a change. The first hospital he and my mom took me to, they said that there was nothing to worry about and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong. But they didn't have the technology to help. 1986. They recommended us to a 3rd hospital, which was a couple hours away. Finally, the 3rd hospital took me right in and performed surgery that day. Turns out I had 5 holes in my heart. Work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays, told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. One that comes to mind is when I was a resident, the ED doctor wanted to admit a mild septic patient with a UTI. I review her labs, and knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. Best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point when the pain became too much to bear, she went to the ER and got a CT. Turns out she had stage 4 colon cancer with 4 inches tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she'd probably still be alive. Was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Wow, I didn't think anyone would even read this, or I would have explained better / tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also, please, if you are concerned about your health in any way or are not happy with your doctor / care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. Happened to me. My daughter was 5 years old and I was still lactating. My doctors didn't listen and told me my husband was playing with my breast too much. I went to my cousin, who is a OB/GYN, and she spoke with my doctor and he ran some test. Turns out I have a Rathke's cleft pouch on my pituitary gland. It was drained and came back. Due to other doctors not listening to me, it took another 8 years for them to find out I have Addison's disease. By then I shocked everyone that I was even alive. Was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift, and started feeling lightheaded, dizzy and fatigued. Given how intense those shifts are, 26+ hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right. Not a doctor. We had someone at work die at her desk and it took almost 12 hours for someone to realize it. They thought she was sleeping and only realized something was wrong when they tried to wake her up at shift change. Pro tip. When seeking a second opinion, don't tell them it's a second opinion. You want a second first opinion, not a confirmation of the first opinion. I have been to multiple doctors who would not contradict the diagnosis of another doctor, even with test results that ruled out the initial diagnosis, or confirmed a contrary diagnosis. Suppose I have one for this as a resident doctor. We saw a kid in the EMERG for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me and I'm not even good at this yet. Did a CT scan. Big ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him, at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so fucking patronizing with our concerns and shove his face deeply into his own ass. Broken neck. No really? So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Now it is your time to shine. Leave a comment beneath what was the worst thing you have seen for a patient another doctor overlooked. Thanks for watching.